So somebody wanted to know about sinus pericranii, and it's important that you know that this sinus doesn't mean like the paranasal sinuses. This is the intracranial venous sinuses, so really it should be venous sinus pericranii. Peri means around, like periscope or perimeter, and cranii means it's intracranial. So we have an abnormal connection, but it's on the venous side between the intracranial and the extracranial venous circulation. And so it's often a congenital thing where the child has a bluish bump on their head and there's actually a connection between the extracranial veins outside of their skull and the intracranial vein, which is the sinus, but not the paranasal sinus, the superior sagittal sinus. So that is a typical sinus pericrania where you have an intracranial to extracranial connection on the venous side. It's pericrania because it's around your skull, and it's sinus, but it's the sagittal sinus or it's some other intracranial venous sinus, and the extracranial venous circulation, presumably through emissary veins or some pre-existing connection there that is just larger than normal. There are very few ophthalmic manifestations of this. However, there are cases where the flow is going retrograde into the orbit. And so it can look like a cavernous malformation in the orbit, or can cause enlargement of the superior ophthalmic vein, or appear as pulsatile proptosis. And that is because we have retrograde flow. Instead of going back to the heart, the flow is going into the orbit. And so it can mimic other vascular lesions in the orbit. Even though it's almost always congenital, there are post-traumatic cases and then idiopathic cases. Patients who have bony deformities or congenital problems in their skull base, like cranial synostosis syndromes, may also be associated with sinus pericrania. It can present to us as like a fistula, and you're wondering if it's an abnormal connection between artery and vein. Only an angiogram will establish that this is venous-to-venous connection, not arteriovenous. So instead of it being an arteriovenous malformation or an arteriovenous fistula or a carotid cavernous fistula, this is a vein-to-vein, intracranial to extracranial sinus pericrania.